She can't roll over or get herself dressed and she's peeing herself and she's crying because this isn't what she thought pregnancy would be like. What are you going to tell her then? That it's just normal?
Hey, Mama Bear. Welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jamie, doula, international board certified lactation consultant, and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea, and let's dive in. We have Becca here today. Becca, I am so glad you're here. I know we both share some feelings about pain and how pain is normalized. And I would love it if we get into that today. But right now, I want you to just tell everybody who you are, what you help moms with, and why you do this work.
Yeah, absolutely. So, you know how you have moms experience like that typical pregnancy pain where it hurts to roll over, get dressed. Maybe every time you cough or sneeze, you're crossing your legs and you're worried about peeing yourself. When you talk to your provider, they tell you it's normal. There's nothing you can do. Buy a belly band, take Tylenol, use heat, wait for baby to come. But that's not the case. So I help moms find relief, be able to enjoy their pregnancy without the pain and without the leaking within 2 weeks by using your pain-free pregnancy resource, the Ultimate Mama Bundle, or just simple pelvic floor coaching where we educate you on your pelvic floor so you can have a better pregnancy and a better birth experience. I started doing this because I myself, like so many birth work, like so many people in this birth area of like helping moms have, I had a traumatic birth experience with my first. And then I had this opportunity to dive into pelvic floor and I had no idea what the heck I was getting myself into. And moms don't know what their pelvic floor is or how it works. And when you think pelvic floor, you think Kegels, and that's not necessarily the case either. So I just learned so much within my first course that I took and I fell in love and I just continued on that mission. And I somehow wound myself up into pregnancy pain because it's something that's incredibly common, but it's not normal. So just because something is prevalent does not mean you should be expected to struggle with it. And I wasn't able to find resources with my first pregnancy. So now I'm trying to give moms those resources so that they can enjoy this experience and this journey. So
Yeah, that is so wonderful. I so agree that pain does not have to be normal. I say pain is not a rite of passage, and our society seems to have some really interesting perceptions on that phrase. I have said things like that on social media and had people go to my business account to leave bad reviews. People feel really tied to this idea that they are supposed to suffer and that there's no other option. And sometimes I wonder if that just comes from a society that's very focused on a medical model where we don't look at root causes. We're focused on fixing symptoms. And since pain is something very individual, it's really hard to fix without medication. And people think medication is the only way to handle it. So, if medication is not the way to handle pain for things like pelvic floor dysfunction, what do you find is the most effective approach for understanding why you're in pain and then approaching that?
patients with pregnancy pain, it's more truthfully, I start with just learn your pelvic floor because you know what? No one's been taught how to do a pelvic floor contraction or how to relax your pelvic floor, which so often we're so focused on like, oh, you're at a stoplight, do 20 Kegels. It's like, okay, but one, are you even doing them the right way? Because you probably aren't. And then two, you probably don't need to do them because your pelvic floor is probably overactive and tight, which can cause problems. So I just truthfully just start with learning your pelvic floor because even like that's the foundation of anything and everything is being able to understand your body and how it works. And with your pelvic floor comes your core because the two work hand in hand. And it also goes into just learning how to breathe the right way. Like, we live in the society where we wear super tight bras, and maybe before pregnancy, we wore like those jeans you can never button. And so you're constantly sucking your gut in and holding your belly in. So now, because we've taught our body to basically suck in and hold things in and we restrict it, it can't function optimally because now it doesn't have that full range of motion where it should, if that makes sense. So basically, just going back to what the heck is your pelvic floor, which is it involves not just your pelvic floor, but your core. It involves your diaphragm. It just takes back to breathing. Like when I teach free classes or just people entering programs and challenges and things like that, they're like, "Oh my gosh, I didn't realize I was breathing wrong. That seems so stupid, but it makes a huge difference." And it's like, I know, but I don't know how to say that to people. It's like, "Oh, you're not breathing the right way. Let's just address that." So it just comes back to basics, I guess, and just teaching that aspect first, and then kind of getting down to the individual person and what could be going on.
You say like a lot of people don't know their pelvic floor. They don't even know what it is. And that a lot of times they think they have to be tighter, but really they need to relax more. Just to share a little bit of my own experience with that. When I was pregnant with my third or fourth baby, I remember my midwife kept saying like, Jamie, you need to see a pelvic floor therapist. And I was like, you know what? Nope, not gonna happen. Like I was in pain. Like my hip would lock and I couldn't move, and my husband would have to carry me to lay down or something. Like it was awful. And I was just like, nope, not going to a pelvic floor therapist because I had in my head that they only did internal work and that it had to be like this very invasive approach, but you help people virtually. Like a lot of your clients are not even people in the same city, state, maybe even part of the country as you.
Yeah.
So clearly, it doesn't have to be this invasive, hands on, like up in my business kind of thing. So how do you address that misconception or that thought that it has to be this like invasive, like pelvic floor is invasive versus there's actually a lot we can do without getting all up in there.
I feel like I don't really have that battle currently, or I haven't had that battle. I don't think there's enough education out there for women to understand that you do have an internal exam with pelvic floor. I think that's something that is still like people have no clue what you do when you go to a pelvic floor. I think more often people are like, "Oh, pelvic floors just do Kegels." Because literally that's what your provider and that's what like nurses in the hospital, that's what people tell you. They're when you ask what pelvic floor is, they're like, "Oh, just do Kegels." And so I think I battle more with that and trying to um, backtrack from there and trying to educate on like, okay, it's not just Kegels. Because if we tell someone, especially after they have a baby, you need to go see someone like a pelvic floor specialist, and you ask why, and they tell you, oh, just to do Kegels. You're like, why am I going to leave my newborn baby or take my newborn with me and spend an hour plus at an appointment that they're just going to teach me how to do Kegels when I can do that at home by myself? So I guess I just haven't had that battle with the invasive and the having an exam before, but also during pregnancy, I wouldn't necessarily recommend doing an internal exam either, just based on like my education and what my practice was in the clinic before I came virtually, which I think that's part of the reason why I came virtually is I never did anything internally with women who were pregnant and they were still able to find relief and be able to overcome things like peeing themselves or having pain or struggling to walk, doing those types of things. So that doesn't necessarily answer your question, but that's kind of like
No,
where I've experienced.
no, it really does though, because I think first of all, that just goes to show how many different myths there are out there about this
Yes.
topic. There's just like you said, there's no understanding. It's like one extreme or the other. There's no in between. But I know you have a lot of people kind of give you the feedback that pain is normal. Pain is just part of the experience of pregnancy. Pain is just part of the experience of postpartum. Peeing yourself is just part of the experience of being a woman. And to say that anything else is true, to say that it can be pain free, some people would say is misleading. So, how do you address those naysayers, those people who say that what you're selling is snake oil, that it's not a thing because their doctor didn't tell them?
It's super frustrating because honestly, okay, I don't like to use this term, but so many women over the last week when I've been talking about pregnancy pain and peeing and how it's not normal, but it's common. So many people are like, women have been brainwashed for literally centuries into believing that these things are normal. And I'm like, brainwash seems a bit extreme to me. But also at the same time, I'm kind of understanding that because there are moms who are fighting me like, I have pain and I pee and it's fine. And if it's fine for you, I'm not here to help you. I am not here to educate you. That is your body, your choice. That is on, and I will support you. That's it. And but those who are like, no, I hate having pain and I hate peeing myself and I hate feeling like this. Those are the people that I'm here to help. And that's who I'm here to like help educate too. Because we have just been taught for so long and dismissed. Like providers are just like, oh, it's normal. Oh, it's normal. And if providers are the first line of defense when someone has these issues and they're told it's normal, then that's that. Like who is to contradict them? And I also feel like we've lived in this society where we just think what the doctors say is law and like that's it, you know? And I've learned over like since becoming even an adult and now a parent of my own children, that's not true. Like you actually have to advocate for yourself within our medical system in the US. Like advocating is a huge piece of finding answers and finding the root cause. If you don't want to find the root cause and you just want to fix what's going on right now only to have problems later on, then that's one thing. But when you look back at like there's no such thing as pain being normal. There really just isn't. Pain is like your body's way of saying like, "Hey, I need attention. Can you help me?" You know? I don't know a single person who truly enjoys peeing themselves. Like usually people are like, "I hate myself. I hate feeling like this. I just don't want to leave the house and I don't want to and I want to feel like myself again." And that's what I'm used to hearing. And no one likes to pee themselves. Like
Right? Like, who wants to wear a diaper in
I know.
August?
Never. Like, it's just so uncomfortable and it's awkward and it makes you feel less, like, desirable and it makes you just feel less of a person, and it's just it doesn't just affect you physically, it affects you, like, mentally and emotionally.
So I remember after my fourth, I did not see a pelvic floor therapist when my midwife told me to, and I should have. And after he was born, I was about 12 weeks postpartum, and I kind of I finally hit that point where I was like, this isn't normal. I shouldn't be doing this. And I don't know what this whole pelvic therapy thing is about, but if that's the only option, that's the only thing anybody's telling me can help me, maybe I have to look into it. And I did, and it helped. And so I just want to say, like, from a patient perspective, not an expert at all in pelvic floor therapy, it was life changing.
Yeah.
Like, it was life changing, but I was going in person. I didn't know that there were options for, like, going online, that there were things I could do at home in the comfort of my own home because it was really hard. I would have to schedule appointments for after my husband got off work. So it was like 6 p.m. I'm like rushing out to go to these appointments. And that's just not sustainable when you've got a 3-month old at home, right?
Yeah, it's hard. It's so hard.
Yeah, it is so hard. So I just like I love hearing that you have these options available for helping moms in the comfort of their own home. What are some of the I know we've talked about like the misconception that peeing yourself is normal and everything, but what are some of the biggest mistakes or misconceptions aside from Kegels that you're seeing moms come to you saying and you're like, why do you think that's normal?
There's just so many things. I just think that we've normalized so much dysfunction, like pelvic floor dysfunction. And I kind of like, I don't necessarily like to say that word either because people are like, well, I don't have dysfunction. That's not me. But if we're having like even muscle imbalances where like our muscles are really tight or really fatigued or really weak, you know, and when we don't utilize our, like, one of the big things too is don't use your core during pregnancy. We don't want you to have abs separation known as diastasis recti. So don't use your core. Guys, if you don't use your muscle, guess what happens? Your muscle goes away. Like you lose muscle if you don't use it. Yeah, you know, like that saying. And so that is super frustrating because it's like you're not just doing like bird dogs and planks and sit-ups. You're like learning again back to the pelvic floor, learning how to engage your core and how to support yourself. And that can actually limit and reduce the risk of having ab separation. Because there's also the misconception that it's how big that separation is. How many fingers can you fit in that separation? But it's about more than that. It's about, do the muscles underneath lift? Can you feel those muscles engaging? Are they working? Like that's more important than how big of a gap you have. We can address the gap. We can get it closer. But if those muscles underneath aren't working, we have to figure that out. And we have to like reignite them and teach them like, hey, wake up. You're missing out here. So I think that's a huge misconception. And if you have a weak core, your pelvic floor takes up all of the extra slack because they work together. And then you have a tight pelvic floor, and now you're having all these other issues. There's also things that people don't realize is pelvic floor related, like back pain and hip pain and pubic pain. And if you've tried all of the things and you're not feeling better, try pelvic floor because I guarantee you that is where like the secret sauce is that you're missing. You said pelvic floor is life changing for you. And truly, I think I felt the same way because as a gymnast of 16 years, I had back issues. Like I was in a back brace my junior year. I was supposed to be in a back brace my senior year. I didn't do college gymnastics because of my back. Like then I ended up having a C-section and epidural and like all these other things. I'm like, I'm never going to be the same again. I am stronger and have less pain after having my children than I did throughout my entire like gymnastics experience, which is crazy to me. So I truly think like pelvic floor was that secret sauce that I needed to have that changed my life. And so I want other women to be able to experience that as well and be able to understand that. I think another misconception I get as I keep going on this tangent is a lot of like pre and postnatal specialists. I even get like I don't know, coaches and exercise professionals and like so many of these people who are like, well, I'm like really strong. I do all of these things. And it's like, that's great. Okay. But I always teach like this 3-step process within my resources. And so often you have one of those steps, you have strength. But just because you have strength doesn't mean you have the right kind of strength or that the muscles are working how we want them to. So again, going back to the basics, learning your pelvic floor, but then also we have to be able to have some sort of like flexibility or mobility. And if we don't have the right flexibility or mobility for you, that can be a problem. And then third one, like you have to learn your pelvic floor. Like you just have to know how your pelvic floor, your core, and like breathing all work together. And I
And I
don't just
think
mean,
this is the 5th time that you had said that, so
yeah,
I
like
want everybody to know this is
that is like
obviously
it.
important.
Like, that is it. I think so often people are like, "Oh, I've done pelvic floor PT and I've done that." And I'm like, "Well, what have you been doing?" And they're like, "Oh, this, and that." And I'm like, "Okay, have they taught you like this, and this?" And they're like, no." And I'm like, why are we not doing that on the first visit? And this is part of the reason why I left the clinic is because the first visit should be education. You should know why the heck you're there and what the expectation is. You should have expectations of like when you're going to feel better, when things are going to change. You should have expectations of what each appointment looks like. And so often that wasn't happening ever, ever.
So
And
what
it's,
you're saying is just
yes,
because somebody is seeing a pelvic floor therapist doesn't mean they're getting the right care plan.
yes, that's what I'm saying. But I don't want that to sound like I'm being disrespectful or like degrading pelvic floor therapists out there because I'm
No.
not. But we all have a specialty, especially within the pelvic floor realm. And mine is pregnancy pain. And more specifically, it's pubic pain. So the pain like rolling over and getting dressed and trying to just walk like that. The thing that no one can ever find answers for. I have that 3-step process and I guarantee you will find relief within 2 weeks, like truthfully. And so when I talk to these moms who go and they tell me they tried it and it didn't work, they tell me what they're doing and I'm like, none of what you are doing is what's included in this process. So if that's something that you want to try, here it is. And so often moms are like, "Oh my gosh, I have to pay." I'm going to just be blunt. The highest you're going to pay currently is 247 for everything. And you have lifetime access of these programs for your life, you know?
Wait a second. So 247 for weeks, months of access to these programs.
Yes.
Or you could go to a clinic where you have to pay out of pocket minimum, and I am lowballing this, $75 a visit.
Yeah, so that's what I was gonna say. So
Like, guys, this is a no-brainer.
right, okay, so let's just break it down for a second. You go to your first visit. The first visit is typically, like, anywhere lowballing is anywhere from, like, $100 to $150 for your first visit, where a lot of times you don't they just assess you. There's nothing else going on. Then you're going for, let's say, 2 more weeks. You're already at by the 3rd week, you're already over $300 because you spend $25 to $50 a visit after that, depending on your insurance and how things work. And if they're out of pocket, they're even more than that. And
Mhm.
so it's like, yeah, it seems like a lot up front, but you have this for literally ever. You don't have to go back when you're pregnant again. You don't have to like you have everything right here. The only thing you would pay more for is if you want to stay in the membership or you want to, add on time in the membership. You want to be there for a year, like those types of things. So it's like you're getting the same help and I'm guarantee you 2 weeks or less. So I'm like, how much time did they tell you that it would take until you felt results? And some are like, they can't give me a time. And I'm like, "Okay, that's fair," because when I was in clinic, I couldn't really give you a time either. But now that all I do is pregnancy pain and all I do is work with, like, especially pubic pain and things like that, I can give you a timeline. I can tell you what to expect, and I can change and alter things so it's fits for a specific person. I have someone with EDS right now who has pubic pain, and I was like, "Okay, we don't need to be doing these things, we need to be doing these things." Like, we're adapting what she needs because it's the right movement for her opposed to let's say if Jamie needed like you needed some help, like it's not going to be the same. So we need to look at what that is and how to help each person.
I think that is such a cool thing too, is to hear that people with these connective tissue disorders are not just doomed. Like there's things that they can do too. It's not just like a death sentence to not be able to find relief, is what I'm hearing you say.
Yeah, it is. It can be more challenging. It can definitely be more challenging if you have other underlying conditions. But if you are someone who has your low risk pregnancy, you don't have any underlying condition and you are just having some pain and discomfort, we can work with that. We can fix that. we can just help support your body. That's all your body's asking for, is some support. There's like misconceptions too, that this is just relaxing the hormones in pregnancy. This is just the way the baby's sitting and like all of these things, which sometimes, yeah, the baby is not comfortable, which we can fix, we can address. Sometimes the baby's sitting there because they don't have room to sit where they should be. And it's because your muscles are tight and they're not working how they should be. So it's all connected and we can fix that. People are like, oh, pubic pain is just because of hormones. And so that's why I have this like instability in my joint. It's like, no, that's, you had something that predisposed you to this, that created that dysfunction. And we need to support that. And if it's just pregnancy, please explain to me why. I've worked with moms 5.5 years postpartum who still have this pain, because they sure as heck don't have relaxin in pregnancy going on. So there's just misconceptions that it's just affecting moms, and it's just because you're pregnant or you have babies or you're postpartum, and that's not. We need to do better. Like, I don't understand why our quality of life as women and moms has just, like, we just let that happen. We've just been trained and like taught and conditioned over like decades and decades and decades that, oh, it's normal, just deal with it. And when you ask other people, they're like, yeah, it's normal. So you're like, great, I just have to deal with this. But what about when your daughter goes through pregnancy and she can't roll over or get herself dressed and she's peeing herself and she's crying because this isn't what she thought pregnancy would be like? What are you going to tell her then? That it's just normal?
What are your thoughts on, because I feel like so many people I talk to are like, "Oh, it's just sciatica. You're gonna have sciatica during pregnancy." Is sciatica just sciatica?
No, no. Honestly, since I started doing pelvic floor, you want to know what I love working with? Back pain, sciatic pain, piriformis syndrome, like all these things that when you go to a clinic, a lot of us are like, oh, we have another back pain patient. I'm like, ah, give it to me. I actually enjoy that. So sciatic pain isn't just that. Like, what happens is your butt gets tight and it pushes on your sciatic nerve. And it's probably because when we stand, when we're pregnant, our butt shortens, so our muscles get tighter, and then our hips are tilted because you're trying to accommodate for your belly and your growing baby. And then now you have all this pain down your leg and you get like a side pain, and you get like, there's all these other things that accompany with it. It's also why, like, quote unquote, you get like mom butt. It's because of how we stand and how our posture is and what we like teach our muscles to do is our glutes take up all, like, your butt takes up all of the like the work, I guess you can say, and like the tension. So then it just, you get a flat butt and you have all this other dysfunction, which really we need to like strengthen your butt. But before we do that, we have to like lengthen those muscles and get those muscles to relax. Because if you just continue to try to strengthen them, they're just going to get
I can feel all the tension in my butt and hips while you talk about
tighter.
I talked with that craniosacral therapist recently, and as she was talking about tension points, I'm like, "Oh, I can feel that as you say it." It's like my
Yes.
body's just reacting to you guys talking about this. But I think that goes to show how real it is and how so many of us do experience that, and that some of it I don't wanna say that the pain is normal, but everything that you explained in how the pelvis tilts and everything, those are normal reactions to the changes in your body. But what are you gonna do to support those changes? And that's what you're really getting at, is there are things that we can do to support those changes. So you talked about your program a little bit. What other resources do you have for moms who are just like mind blown right now? They're like, this whole thing, I just did not even realize that I could thrive instead of suffering. And they're maybe not ready to jump in, but they want to learn more about it. I know you have a podcast. I know you've got some resources for moms to start learning and come into your world and learn all the amazing things you have to say. So, can you share those with us?
Yeah, so you brought up the podcast. So I have Belly Birth Beyond with Pelvic Floor Mama, and we're working on the third season right now. And the first season is like misconceptions of your pelvic floor and discussing pregnancy pain and pubic pain. And I have some experts coming on and who talk about things during pregnancy too. And then second season is all about like trimester from trimester. So like first trimester, second, third, and not just like preparing for birth, but also preparing yourself for postpartum and understanding what postpartum can look like and kind of going from there. And I'm most excited about season 3 because it's moms from the community that are coming on and sharing their stories and their birth experiences. And One of them in particular was already going to pelvic floor PT, and she left her appointment crying. And then she's like, "This can't be normal. Like this can't just be how it's supposed to be." So she went on Instagram, just started searching for the pain that she was having, and mine was the like what popped up. And on Instagram, you have like a 24-hour story. My story was talking about like exactly like word for word what she was feeling and what she was going through. And she's like, I don't know how much this costs. I don't care how much this costs. I'm texting my husband and I'm buying it. And she's been in the community for over a year now. And so there's just, I don't know, there's just some really amazing stories out there. But so the podcast I'm really excited about for the season 3. But I also have like a free guide, which is a great place to start. And it's for those with pregnancy who are pregnant though. It just goes through how to have a pain-free pregnancy and how to support yourself. There's like 6 important steps that I kind of lay out through in the guide, and I give you some movements and stuff to do. I think a big misconception that we were just talking about too is so often it's just doing exercises or stretches, but it's not. Like as you said, I've said it like 5 or 6 times now. It's we have to go like all the way back before you even do the stretches and the exercises. We have to just learn a little bit more about your body and go from there. And some people can feel like daunted by having like a program. So that's why like it's a resource, it's a toolkit. These videos are like 2 minutes long or less.
Oh, wow.
No mom has time to sit down and watch something for 45 minutes or even 10 minutes for that matter. Myself included. If there's like a 10-minute video, I'm like, I don't got time for that. Like you need stuff that is quick and concise and to the point, and that is what you get with these resources. Like in the Ultimate Mama bundle, which is the primary resource about secrets to releasing pregnancy pain and all the tools and tips that you need. So it's practical because I've been a busy mom. I am a busy mom and I'm trying to keep up with kids and I'm trying to take care of myself. And it's really hard to take care of yourself and keep up with your children when you just put yourself on the back burner. So this is an easier way for you to be able to find relief within 2 weeks. And all you're implementing is 5 to 10 minutes of movement and education throughout your day. I'm not saying you have to have 10 minutes at one time. I'm saying throughout your day. So think about little gaps that you have where you pick up your phone and you may not even realize it. You can do something that can help and support you during those times.
I'm mind blown hearing that because like I've got 5 kids and I cannot imagine somebody telling me that I could have a pain-free pregnancy. My babies were 10 pounds. Like
Yeah,
I was carrying a lot of baby. I'm not a big girl. And so my body was really working hard. My body
definitely.
was working really hard, and if somebody had given me those resources, if somebody had taught me sooner that I wasn't breathing properly, like, that was the craziest thing for me to hear, that I
Yeah.
wasn't breathing properly, and I think a lot of you listening might be like, "What do you mean you weren't breathing properly? I know how to breathe." No, you don't. No, you don't. You probably don't. And I'm sure we could go a whole lot deeper into like why, being in fight or flight a lot and different like nervous system components to all of this. But getting back to the basics is how you're going to fix that. And even with my breastfeeding moms, a lot of times we have to start talking about how to breathe in a way that calms the nervous system so that you can
Yes.
start having the proper letdowns, so that you can start healing, so that you can address any of the latching issues because you can't address those issues if you're in fight or flight. And I imagine it's very similar with the work that you do. Like you can't if your body tenses up, like you said, to support things, but also because it thinks it has to fight something or fight
Exactly.
someone.
Mhm.
And so if you are this is probably going down a whole other rabbit hole, but if you are dealing with a pregnancy where you feel like you just don't trust your doctors, you don't like what's being said to you, but you don't feel like you have options. Every time you go into those appointments, you're going to be fight or flight. And that's going to follow you into your birth. And you're teaching moms how to relax that and how to manage that.
Yes, and how to birth without the fear. Like how to be able to advocate for yourself, how to move your body in a way that supports you, how to give birth with the reduced risk of tearing. While you can't prevent tearing altogether, you can reduce the risk of those significant tears like grade 3, grade 4 that really affect moms and their life. I think we forget that pregnancy is such a small piece of our life. It seems like it's a long time and it seems like it's forever, even if we have multiple babies. But when you look at how many years you're pregnant opposed to how many years you're alive, like it's not that significant at all. And we have our bodies forever. And so if we don't take care of them during our pregnancy and during our recovery after having babies, that's why I saw moms like 20 plus years in the clinic who were like, "Oh, I've had this since I had my babies, and now I have grandbabies." And it's like, let's not have this. Or, for those moms who are like, I have an 8-year-old and I've been having this since then. And it's about, if you're like, I don't know, I just have X more weeks, I just got 6 more weeks. I can get through this. But you just have 6 more weeks of this pregnancy. And then how's your birth gonna go? Do you feel comfortable with your birth? Do you feel like you have the tools you need and you understand, like, how to use your body and your pelvic floor and your breathing and advocate for yourself? Can your partner support you? Like, all these, like, a million questions that you should be asking yourself. And then do you have a support system to help you postpartum? Not just, like, with things around the house, but for your body to heal. Because those 0 to 6 weeks when you're, like, resting and not told to exercise or do anything, those are actually the most important. And that's when we address, like, prolapse and healing and healing your pelvic floor. And if we don't reconnect with our body and heal properly, then the more that we're doing during that time, then we're gonna start creating dysfunction because your pelvic floor needs to learn how to work again. It just stretched like 100 times its size so you could let this baby out. And now it has to go back to normal. And now you no longer have a baby in there, and your organs are trying to shift and find their new normal. And your core is like, I'm so weak. You just gave birth to this baby. And I don't know how, like, I have to use my arms on the hospital bed to sit myself up because I'm so weak. Like
Right,
we
and people's default is to just go on Amazon and buy a belly band and squeeze it all back together, and I see you
and
guys
push
cannot
things out your pelvic floor so everything drops even lower. I'm just gonna
you
throw that
guys
out there.
no, you guys could not see her face. She just, like, palmed her face. I know this is a huge thing, but it's funny because you said, like, pregnancy itself is such a short period of time in our lives, but the impact can last forever, and my mom is going through a lot of this right now, where you were talking about some grandmas come to see you, and it's like, you can trace it back to their birth, and I had sent my mom to a pelvic floor therapist because I was like, This is what you need with, her issues she was experiencing." And she was like, "Well, I don't think that's the problem. It's my back. It's my back." And I was like, "It was your back pain that started after my brother was born 24 years ago. Like, that's when your back pain started. You couldn't sleep in your bed. You had to sleep on the couch. Like, you have had this pain." And she's like, "But I'm in shape. I walk, I exercise." And I'm like, "Yes, but your core didn't heal
Mhm.
properly." And then she ended up having health issues with a series of surgeries, abdominal surgeries, which just made it so much worse. And she keeps
Yeah.
asking her doctors about this pain. She's like, "I've got this ongoing pain." And all they want to do is give her pain medication. And finally, I
No.
was like, she's like, "That can't be it. Like, you can't just tell me to wear a binder and take pain medication. Like, there has to be something else."
Yeah.
Now she's like fighting to get referrals for pelvic floor because she finally was like, "Well, if there's nothing else, maybe that is what it is." And
Yeah.
so she's working on trying to start that now, but it's just to reiterate like a real life experience or a real life example of what you just said. Like, there are women dealing with this for decades after having their babies. Like, it's not going to go away. It's
And
not
my
just going to
yeah,
magically get better.
it's not. No. And people don't wanna hear that, but at the same time, sometimes you just gotta hear the tough truth because otherwise I get moms that are postpartum and they're like, I don't understand. My baby's a year old. I'm still having this pain and it hasn't gotten better. And it's like, that's because you were lied to. Like, it's not just going to get better. We have to fix it. It's not just because you're pregnant. It's not just because we have hormones. We have to fix it. And so often providers will just jump to the biggest, like the most extreme scenario, like the amount of hysterectomies we have, and then the amount of hysterectomies we have without seeing a pelvic floor specialist. And now we're having all these other issues. Like now our bladder's fallen and we're having like our rectals fallen. And now we've got like significant prolapse and we're peeing ourselves and we're having constipation. Like it's like it's just so frustrating. And then we have C-sections and it's like, oh, we don't need pelvic floor because my pelvic floor is not affected. Actually, it's more so affected because your core was just cut into. Like your muscles aren't cut into, they're moved out of the way, but you were cut into at your core and now you're significantly weakened. You have scar tissue that's adhering to the healthy tissue beneath and it's affecting how things work. And now you're having back pain and hip pain and you're peeing yourself. And the number of moms who have messaged me going, I wish someone would have told me I could still have pain with sex after having a C-section. Yes,
Oh,
yes.
I know.
You don't avoid pelvic floor dysfunction with a C-section. You don't.
I
You
I'm so glad you're talking about that because I have had so many people respond to the fact that I have had 10-pound babies vaginally with either being like, "Oh, I guess you're wrecked for life," or like, "Don't you wish you would have had a C-section?" And I'm like, "No,
no,
I've had a
no.
C-section. I've had a C-section for my smallest baby. And no, I don't wish I would have had a C-section because that yeah, like I was floored with how much pain you could have with sex after having a C-section. I did not
Mhm.
think that was a thing. And it's just blamed on breastfeeding hormones. It's just breastfeeding hormones.
It's not. It is not. And then people I just we could go on for hours, I think, about
We
this, but
probably could.
it's just so frustrating, the misconceptions that surround literally just the quality of life for moms. Like, we as a society have failed moms. If you truly believe in, like, struggle with any type of pain with your back, with your hips, with your pelvic floor, with your pubic pain, with having sex, with peeing, like, if you're peeing when you don't want to, when you are not sitting on the toilet, like, that's uncomfortable. You probably don't wanna have that happen anymore. It doesn't have to be like that. Constipation issues, diarrhea issue, like, there's so many things that go along to, like, just your pelvic floor, and if we could just educate some people on what your pelvic floor is, like, a general public, like, how about in school? Instead of, like, talking about, I don't know, other things, why don't we talk about what your pelvic floor is? Because you know what? It affects men too. I just don't treat men. I don't have the
Yeah.
desire.
And so my husband is in the Air Force and this is like totally a tangent, but we were talking about pelvic floor and he was saying how many fighter pilots have to have pelvic floor therapy because they are taught how to like manage the G forces using like, their whole body
Well,
and
yeah.
everything. And it like screws up their pelvic floor.
Yeah.
And I have worked with clients who their husbands were fighter pilots who like had these horrible like it's so funny how these things just like come up, right?
Yeah.
But it was like,
Yeah.
no, this affects men too. And you were just talking about the hysterectomies, and then you mentioned constipation, and it just kind of made me think like my mom, back to her. I'm so sorry if you're listening, mommy. Like I'm putting all your business out there. But like she was diagnosed with IBS years ago. And we were recently having a conversation where I was like, we were talking more about pelvic floor and some of her symptoms. And I was like, that could be connected. And so it just makes me think, like she's had a hysterectomy, she's had this and that. And like, how much of that could have been prevented with pelvic floor therapy? But doctors are constantly looking for something to solve with surgery and medications and not, I'm going to try and be as, look for the best. That's what they were taught, right? They're doing their best. They mean well and they think they're doing their best. But what if we hold them to a higher standard? And what if we know that pelvic floor therapy can prevent a lot of these issues and then we might not get all these diagnoses and surgeries and
Mhm.
like that's mind-blowing to
Mhm.
me that that could
It is.
all be so prevented
Mhm.
with pelvic floor therapy through
Yeah.
pregnancy and postpartum.
And I think, like, you talking about all this too, and we were talking before we got on here, social media has blown up with a bunch of criticism about the normalcy of pain during pregnancy and how I am not a doctor. So I do not know what I'm talking about, and I don't have the education to speak on these things, which, just so you know, I do. And I used to go in and talk to providers as like luncheons and be like, I can support your moms during their pregnancy, I can support their births, and even more so postpartum. And they would point blank, you can't see them when they're pregnant. You can't do anything about their pain. You can't help them during, like, literally to my face when I have like success stories in the clinic at the time, telling them about this and telling them about how they overcame pubic pain and they were able to work out again during their pregnancy, how they had a better birth and reduced tearing as a first time mom, a second time mom after she tore completely through, like all these experiences, and they're just dismissing me. So, since they're dismissing me, who is a professional in there trying to have a conversation that we could mutually help each other and help their patients, you moms who are listening, I said, screw this. I'm not going to go to the provider anymore. I'm going to go straight to the source of all the moms, because you know who's affected by it? All the moms. They're the ones who want to know. They're the ones who need this information. And if they're not going to get it from the provider, then what's the point of wasting my breath going into the provider's office when I can just give it to you, give it
No.
here and go out here.
And you know what's so funny about that? As you say it, I'm thinking to myself, like, oh, you don't have the education of a doctor, but like you're the one educating these doctors and they're
Yeah.
declining that education. So think about that if you are listening and thinking, oh, well, a lactation consultant or a pelvic floor therapist or whatever isn't a doctor. You know what? There's a reason we're not doctors. And that's not to say anything bad about doctors, but everybody has their role, everybody has their place, and doctors have to learn from somebody. They learn from specialists in their field. And Becca is the specialist in her field on pelvic floor. She
Mhm.
specializes in this. And so it's not about being a doctor. Being a doctor does not give somebody some magical authority, some magical powers, some,
We put too much power in doctors.
yeah,
we put too much power in doctors. Well, I was just on the call with a mom in the community today about how we have to advocate for ourselves. Like, I had to advocate for my daughter. She's not 3 yet, and she has sleep apnea. Like, I knew something was going on. Like, I've been saying it since she was, like, 4 weeks old, which people are probably like, "You're crazy." But there was a
No,
s
we can talk all about that.
you
Feel
know,
episode of its own.
there was a whole slew of things where I'm like, "Something's going on." And so every single appointment, I brought up something. And I love my pediatrician, so I'm not talking about bad about him by any means. But finally got to a point where I was like, "Okay, we need an appointment and we need to talk about this." And when I got there and we laid everything out, he's like, "Let's go down this path, and these are the tests we're gonna do to see what's going on, because it sounds like you're right, something's going on." We have to advocate for these things. We have to, like, especially, I don't think I was outspoken until I became a mom, because, like, now you have to advocate for this tiny person. And how do we know what they wanna do is right? How do we know that there aren't better alternatives? Like, do we ask the questions of, like, the provider wants to do this, but what are the risks and the benefits? What else could we do? Like, we don't ask those questions. We just take their word as gold, which, we should they're supposed to be guiding us. They're supposed to be, like, guiding us and guiding us to, what am I trying to say? Like, they're supposed to help us with what we want. Like, they work for us. And if they're not supporting us in what we want, then we need to find someone else, or we need to figure that out.
No, I
And
agree 100%. I think pregnancy, postpartum, so much of it, all of it, a lot of the emotional stuff we go through, it's like, I don't know if you remember, like in high school, there was in literature class, it was always like the hero's journey, and they like, had to
oh,
do this whole
yes.
thing. I feel like that is pregnancy and postpartum. It is that transformation of learning how to advocate for yourself and your baby. Like that is at the end of the day what all of it is about and what you're going to take through the rest of your life with you and keep refining. I tell moms the same thing about breastfeeding, it's like your doctor is not necessarily going to give you the referral. You're going to have to ask for it. Just because your doctor said you did a great job trying to breastfeed, it's okay to quit now, doesn't mean that's your only option. And so many moms I meet are like, well, my only option was to quit because my doctor said there was nothing else you could do. Well, why don't we go around the doctor and find a specialist if your doctor is not referring you to a specialist? Because they're going to refer you to a specialist for your baby's heart if they have heart problems. They're going to refer you to a neurologist if your baby has neuro issues. They're going to refer you to an orthopedic if your baby has orthopedic issues. Shit, if they mess up a circumcision, they're going to send you to urology.
Yeah, yeah.
But who are
But
they
when it
sending?
comes
But when it comes
to
to
lactation
breastfeeding and
and
yeah, oh my
pelvic
God.
floor, and when it comes to things that happen to women only, well, I guess pelvic floor is not women only, but, like,
But it's
during pregnancy
thought
and stuff.
of as women
Yeah,
only. I mean,
it
if
it
it's
is.
hard for look, for most things I will be like, "Oh, everything's easier for men." But if it's this hard for women, think of how hard it is for men to get recognized when they start saying, "I've got a pelvic floor issue." They're probably like, "Oh, do you even have a pelvic floor?" Like,
They probably don't understand pelvic floor, and that's the thing, is, like, okay, we're gonna go on a slight tangent here. Like, men with, like, ED, and, they can also have incontinence. They can have issues with, like, pleasure with sex. They can have, like, especially men who have, like, prostate cancer and have to have their prostate removed. Like, all of those people can be helped with pelvic floor. Like, and yeah, and they're probably even more ashamed of it because like, that's even less talked about and even less, advertised and helped and supported.
yeah,
But
I mean, no, but you can take a little blue pill and fix that problem.
yeah, and it's like, okay, well, why don't we just teach you why you're having that problem? Just saying. Anyways,
Oh, well, this has been such a great conversation. I always love our chats because
we just go off. It
we
is
do.
like the spice.
I was hoping to keep some kind of order, but then, my kids interrupted and we just got on our tangents, but that's okay because I think the moms listening like that. They can relate to that. And I'm hoping that if you are listening and you are pregnant or you are postpartum, which most of you are one of those, and you hear this, like whatever pain you're going through, you don't have to keep experiencing.
No.
You don't have to suffer through it. There are things we can do. You might not know what those things are right now, but there are resources here for you, and they are not prohibitively, insanely expensive. And even if they were, they'd be freaking worth it.
Yeah.
What is it worth to not pee yourself when you decide to go to Six Flags for the day?
Moms too tell me that they spent like $1,700 and didn't see any results.
Thank you so much for coming on here, Becca. So, if
Oh,
people want to listen to you, just let's give a quick recap. Your Instagram is Pelvic Floor Mama.
it's MOMMA for mama,
Mhm.
just because that is a misconception. So it's pelvic floor mama for Instagram, TikTok, Facebook, and my website is just pelvicfloormama.com. If you want to get in touch, it's info, info at pelvicfloormama.com. And then the podcast is Belly Birth and Beyond
And
with
we
Pelvic
will
Floor Mama.
and we will link all of those resources in the show notes so that if you are like, yeah, I'm tired of peeing myself. I was in pain all through my pregnancy. Something's got to change. Becca can help you. She's got you.
Yes, let's do this. Let's better quality of life for everybody. And if you learn one thing from this episode, just please stop telling people it's normal. Tell them that they can find some help, even if it's with their someone local.
Yeah, no, I think I'm really overhearing like pain is normal.
Yeah, we can do better. We deserve better. We deserve better.
We really do. Thank you so much.
You're welcome. Thanks for having me.
All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.